Well, hello everyone, and welcome to another edition of CCK Live. I'm joined today by Alex Zach and Kevin Medeiros. I'm Emma Peterson, and we're going to be talking about VA disability ratings for radiculopathy. So Kevin, why don't you start us off and tell us a little bit about what radiculopathy is?
Radiculopathy is caused by a pinched nerve root in one or more than one of the three segments of the spine. Cervical radiculopathy will often cause symptoms in the upper extremities. Thoracic radiculopathy will cause symptoms in the midsection, and lumbar spine radiculopathy will cause symptoms in the lower extremities generally. The symptoms caused by this condition are generally radiating pain, weakness, tingling, numbness, or even muscle spasms. And the cause of the pinched nerve root that results in these symptoms are commonly back conditions like herniated discs, stenosis, and bone spurs.
And Alex, Kevin touched a little bit on cervical, thoracic, lumbar radiculopathy. Can you tell us a little bit more about those different types of radiculopathy our veterans might be suffering from?
Sure. So those are the major three types of radiculopathy. And as Kevin mentioned, they each affect a different part of the spine. Starting from the top and working our way down, cervical radiculopathy happens when a nerve in the neck is pinched. When there's pressure on a nerve in the neck, you might experience radicular pain and symptoms in the shoulders, arms, hands, fingers. The type of pain varies from numbness to tingling to a burning sensation, and it ranges in severity from mild to severe. Those are the levels of severity also that VA will look at in terms of how they're rating the condition. Thoracic radiculopathy occurs when a nerve in the upper back is pinched. And typically people will experience pain in their chest or torso area. It's probably the least common type of radiculopathy. I know that most cases that I've been involved with deal more with cervical radiculopathy, lumbar radiculopathy, which leads us to lumbar radiculopathy, and that's probably the most common type. It occurs when a nerve in the lower portion of the back is pinched. Again, it can cause numbness, tingling, but it's going to affect the lower part of the body, the lower extremities, hips down through the legs. In addition to the symptoms of pain and weakness and tingling, there's also times when symptoms such as incontinence can occur. So it can be more severe.
So to prove service connection for radiculopathy, a veteran has to show the standard, a diagnosis of such, linked to an in-service occurrence or event. And oftentimes it can be due to a back injury, which I think is one of the most common in-service injuries that we see in our practice. So that can be something pretty severe, breaking or dislocating a vertebra or suffering a physical back injury while in service. It could be from operating a weapon or lifting very heavy equipment, jumping out of, folks that were in parachute training, jumping out of planes, hard landings, things like that, or completing just other basic military exercises can cause all kinds of back injuries. And from there, that can lead to that pinched nerve problem that can lead to radiculopathy. So veterans don't need to necessarily trace their actual radiculopathy back to service. It could be due to a back injury. It could be due to repetitive injury. It doesn't have to be a single event. But oftentimes in our practice, we see it related to some type of either repetitive back injury in service or a single more severe injury. So Kevin, can you tell us a little bit about the different types of secondary service connection for radiculopathy?
Like you said, Emma, the primary service connecting condition is generally going to be resulting from a back injury or back condition during service. And given that radiculopathy is most commonly caused by a back condition, veterans will often be able to get service connected on a secondary basis for the radiculopathy as a result of their service connected back condition. So that could either be through the back condition specifically causing the radiculopathy, or the back condition that's service connected, or any other service connecting condition, maybe of the upper extremities or lower extremities, that worsens the radiculopathy. So, as an example, a veteran is service connected for degenerative disc disease of the lumbar spine. Eventually, they develop radiculopathy in the lower extremities. The veteran can file a claim for secondary service connection to establish service connection based on the fact that the radiculopathy is caused by the degenerative disc disease of the spine that they're already service connected for. So, as I was alluding to, the most common causes of radiculopathy are back strains, arthritis, degenerative disc disease, herniated discs, and spinal stenosis. So they're rated in the same way once they're service connected as any primary service connected condition based on the functional impairment in a veteran's earning capacity.
And I would just say, as a practice point, you don't even necessarily need to file a separate claim for radiculopathy. If you've got a back disability that causes this, the diagnostic code for back injuries directs VA to rate your neurological residuals separately. So sometimes we see that in our practice, that VA has granted an effective date of one date for a back, and then later on grants a later effective date for the neurological residual, the radiculopathy, when they really should be part of the same claim. So that's something to reach out to your VSO, your accredited rep, an attorney, whoever you work with on these claims, because that can be a tricky spot for VA to get correct. But as a veteran, not as a medical professional, aren't expected to be able to identify, I have got radiculopathy, grant me service connection. It's really on VA to make sure they're rating you appropriately. So Kevin talked a little bit about secondary service connection. Alec, can you tell us about service connection through aggravation? What if you have something entirely separate from a back disability that is aggravating your neuropathy? Is that something that can be radiculopathy, is that something that can be service connected?
Yeah, and so this deals more with aggravation of a pre-existing injury. So even if you've entered the military with pre-existing condition, you may be able to seek benefits for that condition. The condition is presumed aggravated if it was noted in the service member's entrance examination, but it got worse during the person's time in service, shown through medical records, such as a comparison of reports in service or before, during, and after, or worsened more in service than it would have worsened outside of service, or there's some notation of permanent worsening in service. So a veteran doesn't need to show that a certain incident during service aggravated the disability. And the ratings work very similarly, but differently, I should say, depending on the initial severity compared to how severe the condition is now. This is a little bit tricky. We have a blog on our website for you to reference. I recommend doing that and just speaking with your again, VSO or accredited rep or attorney.
And we see this a lot with our veterans who have multiple periods of active duty. There might be a back injury in the first period of active duty, and then later on it gets aggravated. Some radiculopathy develops, or, in between those two periods, radiculopathy appears and then later it's aggravated. So that's where this sort of aggravation can really kick in. So if you've got multiple periods of active duty, again, be sure to be talking with whoever you work with on your claims to make sure you're really sussing out what you're seeking service connection for and how to go about getting it service connected. So as we talked about before, we've mentioned a few times, mild, moderate, severe radiculopathy. That is how VA is going to rate your disability. They have a number of different diagnostic codes depending on the type of nerve that is affected, whether it's paralysis, neuritis, or neuralgia, all of which would have different medical meanings. But what you really need to know is that they're going to look at whether your symptoms are mild, moderate, moderately severe, or severe. And based on how it's framed, how you describe your symptoms, how the VA examiner describes your symptoms, VA will assign you a rating appropriately based on that. Different nerves have different ratings. So a mild rating for one nerve might be a 10%, and a mild rating for another nerve or nerve group might be a 20. So it really does get very specific depending on what nerve is impacted, what groups of nerves are impacted, and how severe the symptoms are. So to walk a little bit through that, Kevin, can you tell us about cervical radiculopathy and what those ratings might look like?
Sure, yeah. So VA breaks it up into three radicular groups: the upper radicular group, middle and lower radicular groups. Those groups all contemplate different nerves that are in the upper extremities, which I won't try to pronounce the majority of them. But basically, if your radiculopathy affects your nerves, it'll fall into one of these categories depending on which nerve it affects. Those diagnostic codes that contemplate all the specific nerves are 8510, 8610, and 8710. So you'll be able to get all the specific ones by taking a look at those. As far as lumbar radiculopathy goes, like we mentioned earlier, this primarily contemplates the lower extremities, and they're rated within the groups of the peripheral nerves of the lower back and the legs. And the most common that we see in practice is the sciatic nerve that is affected by radiculopathy in the lumbar spine. And that's also broken up into 5 separate nerves depending on which part of the leg is impacted. And the diagnostic codes for those ratings are 8520, 8620, and 8720. For both the cervical upper extremity radiculopathy and the lumbar lower extremity radiculopathy, VA's ratings range from 10% to 90%. So at the lower end, if a veteran has objective signs of impairment, they will get if they have only subjective complaints that a VA examiner or a doctor says doesn't have higher level symptoms, for lack of a better term, then a minimum rating of 10% or up to a moderate rating of 20% will be assigned. And then the more severe the cases are, based on, some conditions cause atrophy, weakness, things like that, the higher up the rating scale we get. So like any other VA rating, the more severe the condition, the higher the veteran should be rated.
Now, Alec, what happens if you have, let's say, both arms are impaired or both legs are impaired? Does anything special happen in terms of your ratings?
VA can apply what's called the bilateral factor. This involves some VA math, so we recommend visiting our website and our disability calculator to determine the percentages affected by this factor. But basically, if a nerve condition affects both sides of the body, such as both arms, both legs, VA should issue a rating for each side and an additional bilateral factor. This refers to when a veteran has disability, again, affects both legs or both paired skeletal muscles. And in these instances, the ratings will be combined for the left and right sides, and then a 10% will be added to those. So the bilateral factor recognizes the limitations caused by the disabilities and how they impact a veteran. In other words, to recognition of the extra impairment or functional loss that a person suffers from having both of their arms or both of their legs similarly disabled. So kudos to VA for that. Again, check out our disability calculator on our website to figure out your estimated VA rating if you do have two arms or two legs that are affected by radiculopathy or any condition.
And I think the bilateral factor is something important to consider because, as folks out there are probably aware, the higher you go on the rating schedule, the harder it is to kick up to the next level. It's one thing to go from 10 to 20. It is hard to go from 80 to 90 and 90 to 100. So if you do have impairment that affects both sides of your body, those little extra 10% kickers can be the difference between staying at 90 and getting to that combined 100. So again, use the calculator, play around with the ratings, and see what happens when VA is appropriately rates both sides of your body for an orthopedic or neurological condition. All right, so that really sums up sort of the quick and fast version of radiculopathy and nerve impairment. Alec, any closing thoughts for those out there watching?
I think particularly in the context of attending a compensation and pension examination for maybe an increased rating purposes through VA, I encourage you to be as forthcoming and detailed in describing your symptoms that you experience as you can, because at the end of the day, these C&P examiners are really checking a box that typically corresponds to mild or moderate, severe, and raters really just go off those checkbox responses. So you want to give the examiners as much to work with so that they can estimate everything correctly, also so that it's documented within the examination report. So if you are denied a higher rating, when the rater or adjudicator is looking at evidence, all the evidence in the examination report, they might see symptoms that, contradict or undermine just a checkbox for mild or something like that. So, as always, really with all conditions, it's important to, um, give as much detail as you can describing those symptoms so they can make the right decision.
Yeah, the only thought that I had was we talked a lot about VA examiners describing the condition or even identifying the condition in the first place, and then how VA is supposed to rate these conditions without, a veteran not necessarily having to file a claim. But if a veteran doesn't seek VA treatment and is treated for radiculopathy or back conditions in the private sector, the VA decision maker might not see that evidence. The VA examiner might not be completely familiar with their case. So for veterans who don't necessarily treat at the VA, I would encourage them to submit private treatment records if they think they have the condition or treated for the condition, or even think that they're already service connected, but it's more severe than they're currently rated.
Great, thanks. That's a great practice tip. Well, thank you all so much for joining us once again. As always, be sure to check out our podcast, our short form videos, and other veterans related content. And for more information, you can visit our blog at cck-law.com/blog. Once again, I'm Emma Peterson with Alex Sack and Kevin Medeiros, and have a good afternoon.